Informed consent. Informed consent is a process by which a person is fully informed about the nature, risks, benefits, and alternatives of a medical or research procedure, and agrees to participate in it voluntarily. Informed consent is an essential component of medical practice and research ethics, as it upholds the principle of respect for individuals and promotes autonomy, dignity, and trust between healthcare providers and patients or research participants. Informed consent is not a one-time event, but rather a continuous process that involves ongoing communication between the healthcare provider or researcher and the person receiving the treatment or participating in the study. The process begins with a discussion of the person's medical condition, the proposed treatment or study, and the potential outcomes. The provider or researcher must provide clear and understandable information, free of coercion or undue influence, and must allow the person sufficient time to ask questions and consider their options. Informed consent must be given voluntarily, without coercion or pressure from external sources. This means that the person must be free to choose whether to participate in the procedure or study, without fear of punishment or loss of benefits. Informed consent must also be given by a person who is capable of understanding the information provided, and who is not under the influence of drugs or other impairing factors. The information provided during the informed consent process should include the following. First, the nature of the procedure or study. The person should be informed about what the procedure or study involves, how it will be performed, and what the expected outcomes are. Second, risks and benefits. The person should be informed about the potential risks and benefits associated with the procedure or study, as well as the likelihood of these outcomes occurring. Third, alternatives. The person should be informed about alternative treatments or studies, and their potential risks and benefits. Fourth, confidentiality and privacy. The person should be informed about how their personal information will be protected, and who will have access to it. First, voluntary nature of participation. The person should be informed that their participation in the procedure or study is voluntary, and that they can withdraw their consent at any time. Informed consent is particularly important in the context of medical research, where the potential risks and benefits are often unknown, and where the participants may be vulnerable due to their medical condition or other factors. Informed consent in research also requires that the researcher inform the participant about the purpose of the study, the potential risks and benefits, and the procedures involved. The researcher must also inform the participant about the voluntary nature of participation, the right to withdraw at any time, and the procedures for protecting their privacy and confidentiality. Informed consent is not an absolute right, and there may be situations where it is not possible or appropriate to obtain informed consent. For example, in emergency situations where the person is unconscious or unable to give consent, the healthcare provider may need to act quickly to save the person's life. In such cases, the provider must use their professional judgment to make decisions that are in the person's best interests, and must inform the person or their family members about the procedure as soon as possible. Informed consent is also not a substitute for good medical practice or research ethics. Healthcare providers and researchers have a duty to act in the best interests of their patients or participants, and to provide treatments or conduct studies that are scientifically valid and ethical. Informed consent is one of the many tools that healthcare providers and researchers use to ensure that their actions are consistent with these principles. On the elements of informed consent. The elements of informed consent are capacity, voluntariness, disclosure of information, comprehension, competence, and permission. These elements are essential for ensuring that the person receiving the treatment or participating in the study is fully informed and able to make an autonomous and informed decision about their participation. First, the capacity to consent. The first element of informed consent is capacity, which refers to the person's ability to understand and make a decision about the procedure or study. Capacity is determined by the person's ability to comprehend the information provided, to weigh the risks and benefits, and to communicate their decision clearly. The healthcare provider or researcher must assess the person's capacity to consent, and if there are concerns about their ability to understand the information or make an informed decision, they may need to seek assistance from a family member, a legal representative, or a trained interpreter. Second, voluntariness. The second element of informed consent is voluntariness, which requires that the person's decision to participate in the procedure or study is not coerced or unduly influenced. Voluntariness means that the person has the freedom to choose whether to participate, without fear of negative consequences or loss of benefits. The healthcare provider or researcher must ensure that the person is not subjected to any pressure or inducement to participate, and that they understand that they can withdraw their consent at any time. Third, disclosure of information. The third element of informed consent is disclosure of information, which requires that the person is provided with relevant and accurate information about the procedure or study, including its purpose, nature, risks, benefits, and alternatives. The information must be presented in a manner that is understandable to the person, and must be tailored to their specific needs and preferences. The healthcare provider or researcher must also inform the person about any potential conflicts of interest, and must disclose any financial or other benefits they may receive from the procedure or study. Fourth, comprehension. The fourth element of informed consent is comprehension, which requires that the person understands the information provided and can make an informed decision based on that understanding. Comprehension depends on factors such as the person's education level, language proficiency, and cognitive abilities. The healthcare provider or researcher must ensure that the person has understood the information presented, and may need to use visual aids, written materials, or other means to facilitate comprehension. Fifth, competence. The fifth element of informed consent is competence, which refers to the healthcare provider's or researcher's competence in obtaining informed consent. Competence requires that the healthcare provider or researcher has the knowledge and skills necessary to obtain informed consent, and is familiar with the relevant legal and ethical standards. Competence also requires that the healthcare provider or researcher is able to communicate effectively with the person, and to address any questions or concerns they may have about the procedure or study. Sixth, permission. The final element of informed consent is permission, which requires that the person gives explicit permission for the procedure or study to proceed. Permission may be given in writing, verbally, or by other means, depending on the circumstances. The healthcare provider or researcher must ensure that the person has given their permission voluntarily and without coercion, and must document the informed consent process in the person's medical or research records. On the types of informed consent. There are different types of informed consent, each of which reflects a particular context or situation in which the consent is obtained. In what follows, I will discuss the different types of informed consent. First, general consent. General consent is a type of informed consent that is obtained in advance of any medical procedure or treatment. It authorizes the healthcare provider to perform any necessary procedures or treatments that are deemed necessary for the person's health, without the need to obtain specific consent for each intervention. General consent is typically obtained at the time of admission to a healthcare facility, and it covers routine procedures such as blood tests, X-rays, and minor surgeries. However, general consent does not cover major procedures that involve significant risks, such as organ transplants or major surgeries. Second, specific consent. Specific consent is a type of informed consent that is obtained for a particular medical procedure or treatment. It is required for any procedure or treatment that involves significant risks, such as surgery or chemotherapy. Specific consent requires that the person is provided with information about the procedure or treatment, including its purpose, risks, benefits, and alternatives, and that they understand this information and give their explicit permission for the procedure to be performed. Specific consent is usually obtained in writing, and it is documented in the person's medical records. Third, implied consent. Implied consent is a type of consent that is inferred from the person's actions or behavior. It is used in situations where the person's consent cannot be obtained explicitly, such as emergency situations, or when the person is unable to communicate. Implied consent is based on the assumption that a reasonable person would consent to the treatment or intervention if they were able to do so. For example, if a person is unconscious and requires emergency surgery to save their life, their consent is implied. Fourth, proxy consent. Proxy consent is a type of informed consent that is obtained from a person who is authorized to make decisions on behalf of another person who is unable to give their own consent. Proxy consent is required in situations where the person is a minor, or they are mentally incapacitated or otherwise unable to make their own decisions. The proxy may be a parent, a legal guardian, or a court-appointed representative. Proxy consent requires that the proxy is provided with information about the procedure or treatment, and that they understand this information and make a decision based on the person's best interests. Fifth, waiver of consent. Waiver of consent is a type of informed consent that is obtained when it is not possible or feasible to obtain the person's consent. Waiver of consent is typically granted in situations where obtaining consent would compromise the scientific validity of a research study, or where obtaining consent would pose a risk to the person's safety or privacy. Waiver of consent requires that the researcher obtains approval from an ethics committee or institutional review board, and that they provide a justification for why consent cannot be obtained. Sixth, assent. Assent is a type of informed consent that is obtained from children or adolescents who are capable of understanding the nature and purpose of a medical procedure or research study, but who are not legally able to give their own consent. Assent requires that the child or adolescent is provided with information about the procedure or study, and that they understand this information and give their explicit permission for their participation. Assent is typically obtained in conjunction with proxy consent from a parent or legal guardian.